For many years we've had collagen and silicone. I think the state of the art is really the hyaluron gels. I think I was quite open-minded always when I hear of another filler. And I was enthusiastic about the Teosyal because of the fact that the hyaluronans are where it's at, and it has the highest concentration of the hyaluronan, and that's 25 milligrams per cc. So that's one advantage. Second advantage is the good volume. Third is that you have a 360-degree turnability control of the syringe. Fourth is it's quite easy to inject. Fifth is that it's better patient tolerance because of the very exceedingly low protein level, so there's less redness and swelling. And finally, I think just the durability and flexibility. It is a range of products, not just one product, and that gives you, as the physician, it gives you the most control and ability to give the best correction to a patient. So I think if you can have a more comfortable procedure with less swelling and a very compatible product, that's where Teosyal is. With new patients, I think it's important not to necessarily plunge into the permanent type of injectables. They have an advantage and disadvantage, and the main disadvantage being you can get delayed granulomas or irregularities. So as far as safety, it's always nice to have a safer product as possible. So with new patients, I always encourage a temporary type of filler. Also with Teosyal, it's the only single filler that you could use safely in all areas, in the sense that you could use most of hyaluron gels in all levels in the skin, but some of the permanent ones are restricted. You can only use them in the deep dermis. For existing patients, it's nice to offer them an option of another filler that maybe causes less swelling and redness and is better tolerated. The way I guide patients is just to inform them of the range of options that we do have. And if they've had one particular brand of hyaluron gel in the past and they've been enthusiastic with that, then I'm not going to convince them to use another product. But usually once I explain that, there's different generations of the hyaluron gels, and this is Teosyal is what I consider a third generation. They will almost always choose the Teosyal. It's a little more elegant of a product. There's more concentration so they're getting more value for the same dollar value. It has a very nice artistic feel, in the sense that when you use a filler, you want to be able to have the correct feel as you inject. That also means that if it flows nicely, you're going to get a better correction. It's got a 360-degree turnability, which means that you can orient the bevel of the needle in 360 degrees. And some of the other hyaluron gels don't have that ability, so you're a little more restricted as to which direction it comes out of the needle. They've also been clever with the Teosyal products to match the size or gauge of the needles with the product. So for instance, deep line Teosyal is also called Teosyal 27, and they've called it that because it's important to use that particular size needle, and if you use that, you get a better result. I think a minimum of 1 cc is important for almost all fillers. One of the problems in the past is having smaller size syringes which give inadequate correction, or you end up having to use more syringes. So it's nice to have a minimum of 1 cc. They also have a half cc if you want to just treat a small area, but most patients when they come in are going to be using at least 1 cc or more. I've been using Teosyal for a year now, and so I have the advantage of following up patients over that period of time, and I've been able to compare Teosyal to the other hyaluronans and found that it's equal or better than the others as far as longevity. I think realistic expectations with any of the hyaluron gels is important. The hyaluron Teosyal is present in the skin for a year, in the sense that it's detectable in the skin for up to a year. But areas that are higher motion, such as around the mouth or the lips, where there's a lot more movement or mimetic function, it's not going to last as long as when it's put in an area, say, such as the cheeks, where it will last longer. So generally around the mouth or lips, I'll explain that it lasts about 5 to 7 months. In the cheeks, it's more like 8 to 10 months. And that's, as with any of the temporary fillers, the degree of correction goes down month by month, very slowly and gradually. So it's not a continuous correction for that whole period of time. I've had no delayed reactions whatsoever. I've had no immediate reactions other than what you would expect with any injection, in the sense that there may be some erythema for patients that are more dermographic, and some swelling, but again I find that those are a lot less than with the other hyaluron gels. So I've had no negative reactions to Teosyal. Ultra Deep is fantastic because areas like the cheek where we're looking for volume correction used to be you would have to use a biphasic type of product, hyaluron gel, which may require cannulas or very large gauge needles like a 16 gauge needle. So the advantage of Ultra Deep is we can use it very deep in the skin, but apply it with a small gauge needle. So it's a lot less traumatic, so there's less chance of bruising or minimal swelling. And it's a lot quicker procedure, and because it's highly cross-linked, it lasts a long time. It's just a fantastic thing to see a volume correction immediate, sort of a mini cheek lift with something like Ultra Deep. The other area I use it is in the pre-jowl sulcus, which is an area just at the corners of the mouth, sort of at the marionette lines, and there you can actually get a little lift of the jowls of the lower cheek and do some really lovely things. Looks very natural. The advantage of the Kiss is that it's monophasic versus biphasic, and that applies to the whole Teosyal range. So what does that mean? Well, monophasic means that the gel is uniform throughout. That means there's less surface area, so it's going to last longer in the skin. Whereas the biphasic hyaluron gels tend to have higher surface area and they can be more firm. So what I like about Teosyal Kiss is it's a very soft product, which is appropriate for the lips. There's less lumpiness, so it's a lot more smooth effect, and that's going to look more natural. So not just the patients, but the patients' partners, when they go home, they've got to like the result as well. And if everyone likes the result and it looks more natural with less downtime, I think that appeals to all of us. I've been using Teosyal for a year. I can say that I've treated patients with the Kiss products as much as 10 or 11 months ago, and seen them within the last month, and they still have a reasonable correction. So that's beyond what I would even expect. So I think it's lasting a very good length of time. To compare it to the other hyaluron gels, I don't like to say that one lasts longer than another. But my sense is that it lasts at least as long as the others. Areas like the lips where we have Teosyal Kiss instead of a firmer type of gel, there's less swelling, so they can go back to work more quickly and more natural. So it's nice to have a filler that you can use in the lips that's intended directly for the lips. When you have a new filler, it's important just to have a few hands using it at the beginning, people that do use filler quite a bit. So it's nice that they didn't, Coherent didn't sort of launch it generally, but did use it for some select physicians. And Coherent's been very good about feedback, in the sense that I did have comments about the initial syringes that have been modified that are certainly a lot better. So they went from good to excellent. So I have only good things to say about Coherent. Sometimes it's hard to recommend yet another filler, especially when we get used to the hyaluron gels that are already out there. But the reason I've been enthused is because of the better patient comfort, the longevity, the higher concentration, the ease of application, and if I transmit that information to my colleagues and somehow convince them to at least try a few syringes, once people try it, I think that it sells itself.